Welcome back to Drug Talk, everybody. In today's video, I want to go over some recent changes to my medication protocol after my manic episode that I just had about a month and a half ago. So to start off, I'll quickly go over what I was using before the manic episode. So I was using 1,050 milligrams of lithium, 20 milligrams of loxapine or Zylac, an antipsychotic, 15 milligrams of zopiclone, and then occasionally I would use clonazepam just throughout the day as needed, 0.25 milligrams for anxiety. So despite taking these medication every night, I still got to the point where I couldn't sleep and ended up having a manic episode. So some changes had to be made to the medications. So the first change, which I think is the most straightforward, is the increase in dose of lithium. So like I said, I was taking 1050 milligrams. I'm now taking 1350. The reason we had to do the increase is because when I got my blood levels checked for the lithium level in the hospital, my level was actually 0.4 and it's supposed to be 0.8 or 1.2. So we increased the dose to 1350, and after a couple weeks my level did get up to over 0.8. We actually think the low lithium level really contributed to the manic episode and may have been the main factor as to why my mood elevated and my energy rose, and I ended up needing to be hospitalized. The second change was the loxapine. So like I said, I was taking 20 milligrams of loxapine. Pretty straightforward change here. Just increased that dose to 25 milligrams. Now that used to be my only antipsychotic, but we've also added in quetiapine. While I was in the hospital, we started quetiapine at 600 milligrams. Very heavy dose of quetiapine with the loxapine 25 milligrams. Slowly decreased the quetiapine down to 300, and now it's at 150. With the quetiapine, even at 150, so like I said, now I'm taking two antipsychotics, the loxapine and the quetiapine. I notice when I wake up in the morning, I'm still very tired. It takes about an hour and a half to 2 hours to really feel awake, to get rid of that zombie feeling, just that complete tiredness and fatigue. So after about 2 hours, I start to feel kind of back to myself and I'm able to function throughout the day. So one change that I'm actually a little bit nervous about is that we actually got rid of the zopiclone. Like I mentioned, I was taking 15 milligrams every night, and I was doing that for about 6 years, and it did help me sleep the entire time throughout those 6 years up until this recent hypomanic then manic episode. So a little bit nervous about getting rid of that, but we replaced the zopiclone with clonazepam, 2 milligrams at bedtime for sleep. This is unrelated to bipolar, but I'll just throw this in there. I did have to start a blood pressure medication as well. While they were testing my blood pressure in the hospital during my bout of mania, my blood pressure was a little bit high, so we started off on 25 milligrams of metoprolol, but no side effects related to the metoprolol at this point. So to recap the changes, we increased the dose of lithium from 1050 to 1350. We increased loxapine or Zylac from 20 milligrams to 25 milligrams. Got rid of the zopiclone 15 milligrams and replaced that with clonazepam 2 milligrams. And then, like I said, we added in the quetiapine, a brand new medication, and that's the one that I feel like I'm having the side effects from. So hopefully in the near future, we can get rid of the quetiapine and just have loxapine, clonazepam, and lithium. Well, that's it for today, and I just want to quickly say, although I don't cover the 6th episode of mania that I've had in my life, I do cover my first 5 episodes in the 5th episode, Inside the Manic Mind. So if you want to check out this book that kind of goes over in great detail those manic episodes, just click the link in the description below. Take care.